I'm just gonna mute myself so it, you know.
And I'll just go. And then if you have questions, feel free to ask. So let's get started. I'm Lori Torrini. I'm with Spirit Keeper Equine Sanctuary, also doing business as Spirit Keeper Animal Sanctuary, as we have other species here. And I'm doing this on behalf of Unity Environmental University. This is going to be a case study of a horse we actually have here named Mario. And at the same time, we're going to use his case study to go over what equine gastric ulcer syndrome is and maybe some preferable diets to treat and prevent equine gastric ulcers, and also some things specifically with Mario that are maybe related to this that are going on. So what we're going to be talking about is I'll introduce you to Mario. I'll give you the background of his case. I will go over what equine gastric ulcer syndrome is, just very briefly. Some things to consider, like the horse's GI tract, their stomach, diagnoses, treatment, prescriptions, supplements, related diagnoses, and veterinary follow-up. I'm going to go over a diet plan and feed for him, the management environment, like his routine and ongoing assessments that we're doing. I'm going to go over what's in progress right now for him, recommendations from our veterinarian, evaluations we continue with, and what this might mean for Mario. And then I'll wrap it up and I'll share some select resources with you and answer any questions you have. So Mario, I chose him to use as a case study for this presentation because he absolutely he's had a past history of ulcers prior to arrival here in 2014, but then he's had a current history of ulcers within the last year that are causing him now some acute issues. And it is an ongoing case that I can show you in practically real time. He's a 17-year-old appendix quarter horse. That just means that he is a registered quarter horse, but he's had heavy influence from the thoroughbred breed within his breeding. He's a chestnut gelding, and he arrived here in the summer of 2014. And he had a history of colic before he got here, but never any instances of colic after he arrived here in 2014 until March of 2023. So in March of 2023, Mario had what our veterinarian diagnosed as spasmodic colic. So he experienced sudden acute pain. Like he was fine 1 minute and the next minute he was sweating, he was breathing hard, his heart rate and respiration were elevated, he was rolling, he was getting up and down frantically. He would bolt, he would paw at the ground, he would kick at the ground and at walls or at the fencing or at his loafing shed. We had the vet out and he was given analgesics, and those analgesics included Banamine. And he was also given treatment to decompress his stomach, nasogastric tubing. So they pass the tube through the nose down into the stomach, and they relieve any pressure that's in there, whether usually it's food or water that's backed up in the stomach. And that actually resolved super fast. I mean, 1 minute he was fine, then he was in acute pain, and then we had the farm call, and literally within a couple of hours of the vet getting there, he seemed fine. He seemed like nothing had ever happened. So what could cause that in March in Colorado? It was cold. We do have heated waters, but sometimes the horses don't like to drink as much. We do have 42 horses here. No one else experienced any issues during that time. But if Mario has other things going on and he's drinking less water, certainly that could impact it. It could have just been a coincidence. So he didn't have any problems again until December of 2023, when he experienced what was a presumptive diagnosis at first of an impaction colic. And this is something that came on slowly over several days. He just started to behave more lethargic, more apathetic, not wanting to eat as much, or he would start eating and stop eating. He would lay down for longer periods of time. He was just clearly not feeling well. And the vet came out and determined that he likely had an impaction colic. There wasn't much stool. There was some dried stool near his rectum, and she was able to get that out. But just all the symptoms and signs led her to believe he had an impaction colic, and his stomach was likely getting backed up with fluids and whatever food he was eating. And so we chose at that time to have him admitted to a hospital, where he was hospitalized for 8 days, and he was on IV fluids because we wanted to make sure he was well hydrated to help things move through the gut. He was given analgesics, which again included things like Banamine, which is a non-steroidal anti-inflammatory drug. And he was diagnosed at that time with slow emptying, which means the stomach is emptying slower than, he's eating faster than the stomach is able to empty into the small intestine. And that can be something wrong with the horse on its own. It's called gastroparesis. It's common in Frisian horses, but more than likely it was because of the impaction colic and the presumptive ulcers. At that time, they were presumptive. That was just a side effect of that. So after 8 days in the hospital, when he was stable, when he was passing manure normally, when he was eating and drinking normally on his own, he was sent home. So this leads us to lots and lots of research I subsequently did on equine gastric ulcer syndrome so that I could probably care for Mario here at our sanctuary. And the scientific literature is rich in ulcer research, both for horses and other animals, including people. And for horses in particular, for everyone, the development of ulcers and the presentation of those ulcers are going to depend on that individual organism's gastrointestinal tract, how it evolved to consume and process food, etc. So the horse's GI tract is unique from ours and from some other vertebrates in that it is meant to have food in it nearly 24/7. They are trickle feeders. They're meant to graze almost 20 hours out of a 24-hour day and always have food in their system, which means a couple of things for their digestive tract. They don't have a gallbladder. The gallbladder is something that in our body stores bile that is needed to be dumped into the system to process lipids or fats or when we eat. So the bile is stored in the gallbladder until it's needed to help break down food. But because the equine's digestive tract is meant to have food in it all the time, they don't need a gallbladder to store that. They also always produce hydrochloric acid in the stomach. They have glands in the stomach that are always producing stomach acid. So our stomachs don't produce this acid until we eat. So if we're not eating, if we're fasting, our stomach's not producing acid. But because horses evolved to have food in their stomach all the time, the acid is always being produced, which means if there is no food in the stomach for the acid to work on, because acid is corrosive, if there's no food for it to corrode and start breaking down, it's going to break down the lining of the stomach instead. And that is, in a nutshell, what contributes to gastric ulcers in the horse. So if you look at the picture of the stomach here, the glandular region on the bottom of the picture is where those glands produce the hydrochloric acid. The upper region of the stomach, where you see the esophagus there pictured, that's where the food enters the stomach after we eat it, after the horse eats it from the mouth. That is not lined with anything that will protect it from corrosive hydrochloric acid. So the food goes into that part of the stomach, the acid starts to break it down, the food moves to the bottom of the stomach where it's broken down more, and then it passes through the pylorus and into the small intestine where nutrients are absorbed. So when the stomach is empty, that's a problem because hydrochloric acid is being produced and just eating away the stomach lining. What can also happen if the stomach is empty and the horse is galloping, running, trotting, is acid from that lower region of the stomach is splashing up into the upper region. Or as you know, if you do sit-ups or really strenuous exercise, and you're tensing up your stomach tends to get smaller. And if you have a full stomach, it's uncomfortable. So with an empty stomach, if the horse is tensing those abdominal muscles, it is actually contracting that stomach inward and pushing the acid up into that unlined portion of the stomach. And that is going to cause lesions to develop. So what are some other things that can contribute to equine gastric ulcers? Well, the possibilities in general, and for Mario specifically, are stress, a feeding routine, and then other disease. And stress can be caused by almost anything. Horses are prey animals, so they're always worried about getting eaten. They evolved to run away from danger and threats, and their first form of defense is flight. So everything worries them. And so stress of changes to their neighboring herds, changes to their caretakers, changes to feed, water, changes to their living environment, things that break up their routine or make their predictable routine suddenly surprising to them can cause them stress. So feeding them less than 24/7 can also contribute to these ulcers, which means if your horse is on a 1, 2, or 3 times a day feeding regimen, that's likely not going to be enough. It's certainly not natural. And thankfully, some horses tend to tolerate that okay, but it's not natural for them. And then liver inflammation can contribute to gastric ulcer development, or ulcers can contribute to liver inflammation. Which comes first? Sometimes we don't know. Mario is having issues with liver inflammation. He was being fed only 3 times a day, and there were changes not to his herd that he was with, but to a neighboring herd. So these things could have all contributed to why he developed this issue. A study that I found really interesting that I want to highlight is this study by McClure in 2005 of 20 horses, which were split into 2 groups of 10. And one group had no changes other than the fact that their 10 conspecifics left. And group 2 was transported to another location that was 4 hours away. They were forced to do 30 minutes of exercise twice a day, and they were kept in a stall, and they were fed twice a day. So they had a lot of changes to their routine, and they underwent this study for only 5 days. And on day 0, they were scoped. So a scope is placed into the stomach with a camera so that the diagnosticians can see if there are any lesions in the stomach, any tears, any damage to the stomach, any pre-existing ulcers. There were not. On day 5, 7 of the 10 in group 2, these were the ones that were transported to another location, had developed gastric ulcers, and 2 of the group of 10 that were left at home with no changes had developed ulcers. And these ulcers began to be present in both of these herds within 48 hours of the study beginning. So that's a really short time that these horses can develop gastric ulcers. It's really scary to think that basically lots of the routine things that we do to use our horses for or subject our horses to can cause them so much stress and be so contradictory to how they evolved to live that it's causing ulcers within a super short time, including them being separated from their herd mates. So some considerations after reading this and other studies, but specifically this study, is that the 20 horses were all the same breed. They were paint horses, and they were all of similar age, 17 to 21 months old. What's my concern with that? These are babies. So these are not even adult horses yet. So these babies maybe would likely be more stressed by changes that they hadn't yet become accustomed to. So if you have, say, a paint horse that's 15 years old and has become accustomed to being trailered, short separations from its herd mates, is conditioned to do exercise, they may be less stressed than these young horses who maybe hadn't experienced trailering before, hadn't experienced forced exercise routines before, hadn't been separated from the other horses before. I don't know that. It wasn't indicated in the study, but it's a possibility of something to consider. These were privately owned horses that were up to date on vaccinations, dental work, farrier work. They were halter trained to lead, but they had no prior experience with being in training. So what the researchers did was there were replicates of horses that they formed, which means there were 2 stallions in the study. So one stallion was kept in group 1 and one stallion was put in group 2. So let's say there were 2 mares or 2 fillies that were the same age. One would be placed into each group. So they tried to make each group a replicate of the other group as much as they could. There was only a 10-day acclimation period prior to the study starting, which means they put these 20 horses together and they were in the same paddocks and had the same management practices and caretakers. To me, 10 days isn't a very long acclimation period to form social groups and to establish predictability within a routine. I'm working on a study with some snakes right now, and their acclimation period to their habitat, we're doing a habitat use study, was 30 days, was a month before we even started taking observations. So I'm not sure about this acclimation period being long enough. they may have already begun to experience stress just being placed into this new situation and not being given enough time to acclimate. 2 months prior to the study, all the horses were at the same location and on the same feed. They just weren't in the study setup. And so other herd dynamics to consider are that there were no changes to the group 1 horses during the study, except that now their herd is cut in half. All the changes were applied to the group 2 horses. And if you follow my red arrow, I have these other changes that I think are important to consider. And a triangle is usually how you abbreviate changes in notes. So that's why the triangle's there. The herd makeup for both groups changed. For group 2, the location also changed. Their housing and environment also changed. They went from a free paddock situation where they could roam around freely with other horses to being housed in a stall at a different location. And instead of given free choice hay in the paddock, they were given hay and other food twice a day. And then they had the introduction of forced exercise. So again, my concerns are the 10-day acclimation period, the age of the horses. And there were also caretaker changes. The caretakers didn't take care of the group 1 horses and then drive 4 hours and take care of the other horses. So just a change in who's interacting with the horses might also cause them stress. And I'm sure there are other things that you can think of. There are lots of other things I can certainly think of. Okay, so ulcer risk factors in general, I want to go over, but the ones that I think may be contributing to Mario's ulcer specifically are in brown. So stress, any type of stress, which basically is a change in the routine, a change in the status quo. And there can be good stress, but we're talking about toxic stress or stress that is not good stress where something exciting happens that's a happy occurrence for the horse. Like, oh my gosh, I'm getting extra hay today. Or, oh, look, there's a new horse and I really like this horse. But stress like my best friend is taken away. Or instead of having free choice, hey, now I've got to wait for meals twice a day, that kind of stress. Mario had 2 horses in an adjacent herd die. We're at an equine sanctuary. We care for special needs horses. They come here already with issues, and then some of them are quite old. And unfortunately, we had 2 in the adjacent herd die within 15 days of each other. Now, Mario wasn't specifically in that pasture, but he did interact with that herd over the fence. And it's possible that that stressed him more than we're aware. Transportation, high starch diets, and stall confinement or housed in a stable with no turnout are all things that can contribute to ulcer development. Intermittent feeding schedules, and Mario was on a 3 times a day feeding schedule where his herd was given free choice hay twice a day until it ran out. And then on a 3rd feeding, they were given soaked beet pulp as a form of roughage in buckets that are scattered around their field, and they can eat out of those, the soaked beet pulp, until it's gone. But that is still not the same as having 24-hour access to food. Separation from or changes within the herd. So perhaps separating him to treat him for the colic caused him stress because he was separated from his conspecifics. He spent 8 days in the hospital. Was that initially for an impaction colic? And during that time, he developed the ulcer secondary to that? I can't be sure because he wasn't scoped when he entered the hospital. He wasn't scoped until later. Racing and intense exercise can cause ulcers to develop for reasons I talked about that have to do with how the stomach works, and that's acid splash. Illness. So Mario's liver enzymes are elevated, and they are actually twice as high now as they were when this all started, which is concerning. So if he had prior liver disease or damage, it could have contributed to ulcer development. However, the ulcers could have also contributed to liver issues, and that's something we have to further investigate. He was given non-steroidal anti-inflammatory drugs. These are hard on the stomach lining. He was given those for both episodes of colic. So did those either cause or exacerbate pre-existing ulcers? Possibly. And then management changes can cause or contribute to the development of ulcers. He didn't have any management changes, so that necessarily didn't apply to him. And I want you guys to keep in mind that 11% of horses just left on pasture, even if they're kept with their herd, even if they're given free choice hay and grass, even if nothing else changes and there's no stress, 11% of horses kept under captive management. This doesn't apply to wild herds that we're aware of develop ulcers anyway. So it's something that they are prone to. All right, we've already talked about these considerations with Mario specifically, his neighboring herd, the non-steroidal anti-inflammatories that he was given during the colic as a treatment, and TX just means treatment. He had no changes to vet, dental checkups, fecal deworming, hay feed, his location, his routine, or his herd that he specifically lived with. Post-treatment for colic and post-diagnosis of the ulcers with the liver inflammation, he has been getting monthly vet checks along with blood tests. And an alternative diagnosis is possibly liver disease or liver damage from something. Now, the elevated liver enzyme that we're looking at is called GGT. It's gamma glutamyl transferase. It can also indicate damage to the bile duct, but he doesn't have that because, he doesn't have a gallbladder. But there is a bile duct that leads from the liver to the intestines. And if that's damaged or inflamed for some reason, it could also cause this elevated enzyme. But it's something that now we have to look at possibly doing a liver biopsy or a liver and a liver ultrasound of. But we have to make arrangements at a Littleton Large Animal Hospital or Colorado State University to do that. Gastroparesis is something I already mentioned that can be something wrong with the horse in and of itself, but in his case, possibly just a side effect of these other things going on, and that's the slow emptying or delayed emptying of the stomach. So he eats faster than his stomach's able to empty. So how are we mitigating that? You can see the slow feeder net in the picture here. He likes to shake it and dump the hay out of the net onto the ground and then eat it. That's still okay. It means he's not eating it too fast. Other things that we can use to mitigate the ulcers are omeprazole, which is a protein pump inhibitor medication that just limits the amount or stops the amount, depending on the dose, of hydrochloric acid that the stomach glands are producing. He's also being given ulcer prevention supplements. We're increasing his feed frequency, and he's getting smaller, more frequent meals. So initially, when he was sent home from the hospital, the vet prescribed for the next 2 weeks, basically 15 days, free access to water. He gets that anyway. He has an automatic water as well as a bucket that hangs in his stall that we fill anytime it's empty. 4 times a day, they directed us to give him 2 quarts of dry senior, which is a complete feed. It's not a grain like oats. It's a complete feed that our senior horses eat, that if they had no teeth, we could mix that with water into a mash and it has everything they need in it. So this complete feed typically does contain already Timothy hay, beet pulp, alfalfa, things like that. 2 quarts of Timothy alfalfa pellets soaked. That's what you see in the picture here is the senior feed and the soaked pellets. And then a 1/4 flake of grass hay. So that was the first 15 days home. His nutrition now is free access to water, as I described. He gets Timothy and alfalfa flakes of hay in this ultra slow feeder net all the time. That's what you see in the video. And ultra slow feeder net means the holes are really small, smaller than a regular hay net that sometimes you see with bigger, like maybe 2 by 2 inch squares. These are 1 inch squares. They're the smallest ones I could find. Once daily, he's getting Smart Digest Ultra and Succeed, which are supplements with some scientific backing that show that they support, once treatment has occurred, that they support gastric health so that the horse does not redevelop the ulcers. But they're not recommended for treatment. This is after the treatment is finished, that they can support the horse in not developing those ulcers again. And then 4 times daily, he's getting 2 quarts of alfalfa pellets soaked and 1.5 cups of Purina Outless pellets, which is another product with some scientific backing to indicate that it reduces his chance of developing ulcers again in the future. So he's getting a lot. Management guidelines for Mario at this point are adherence to the nutrition plan, access to water in more than 1 location, free choice exercise. So no forced exercise, but his stall has access to a run, which has access to a corral that's about a 1/2 acre. So he's not confined in that stall that you see him in. He is free to go and exercise as he pleases. choice access to shelter, no stall confinement. So he has that stall as a shelter that he has access to, and it has an overhang outside of it in the run, and then he has the corral. Opportunities to engage with other horses. This has become complicated because we have seen cognitive changes in Mario since this all started. His herd has rejected him, and he isn't getting along. He's no longer getting along with other horses. This is leading me to believe he may have something going on with the liver, because anytime you start to get organs that are malfunctioning, it can cause cognitive changes. So he is currently being kept alone, but adjacent to other horses. So he has 7 horses on one side of him, 1 horse on the other side of him, and 2 horses on the third side of him. So he has access over a barrier to other horses. But he has shown us during his recovery that it's not safe to put him with other horses at this time, because he's having some behavior strangeness, and the other horses are picking up on that and treating him in a manner that they wouldn't normally treat him in, like they're being aggressive with him. So that's complicated, and that's why there's an asterisk next to that. He has continued veterinary monitoring, and then we have medication available for flare-ups and for ongoing treatment. So Ulcer Guard, which you see in the upper left picture, is the over-the-counter omeprazole. And that is going to be for prevention of ulcers. And the veterinarian can direct us to give him a treatment dose of it, which is going to be more than the over-the-counter dose. Gastric Guard, which you see in the lower right, is the prescription medication. It's still omeprazole, but the concentrations of it are different. This is just a video to show you that he does have interaction with other horses. This is Mario on the left. These are some of the other horses on the right. These stalls have access to runs, which have access to larger corrals that the horses can move into. So he isn't isolated as in he's completely alone, but we're not comfortable at this time letting him with other horses. General management for ulcer prevention, that if you have a horse that doesn't have ulcers and you just want to make sure they don't get them, I recommend freedom from confinement, put them on pasture, or have some kind of a corral or a large space that they can be in and behave normally, with access to shelter if they choose. Continuous access to grass or hay. Our grass in Colorado is basically weeds and dry if we don't plant and irrigate and water. So we throw hay out into the pastures. Daily alfalfa, or an evidence-supported supplement to buffer the stomach. Alfalfa is higher in protein and calcium than like Timothy hay, and so it is going to buffer the stomach more than regular hay does. But supplements can also do that, like antacids. The steady companionship of other horses in a stable, unchanging herd setting is really also another important factor in keeping your horses stress-free and mitigating ulcer development. You want to avoid subjecting horses to forced exercise, intense exercise, intermittent feeding. Basically, don't let them get an empty stomach, and avoid high starch and high sugar diets. Avoid transportation and trailering, stall confinement or changes to routine, and separation from herd mates. Now you're probably thinking, but these are normal things we do with horses. We trailer to shows, we trailer to clinics, we trailer to competitions, and we trailer to go trail ride. All of that stuff, despite the fact that we choose to do that with our horses, is contrary to how they evolved to live and exist. And we are contributing to the potential for them to develop ulcers. This is an example. This is our sanctuary. So what we do is we have all of the shelters and buildings kind of congregated in one area. The water is also up there, and we feed them their initial meal up there. But then what we do is we drive hay way out as far as we can get to the other end of the property, and we pile hay out in different areas so that the horses don't get stuck in this mindset of all of our resources are in one spot. We don't need to walk out there. We're just going to stay here around our sheds, and we'll just wait for more resources to come. We want to encourage natural movement, natural grazing as much as we can under captive management. And so we scatter hay around the field, which means at some point during the day, they're going to walk out and they're going to engage in grazing in a different area. And these pastures are about 10 acres. We have one that's 15 acres, and we have one smaller one that's 5 acres. And then you see that they can interact with other horses in a natural open setting. So what we're doing right now, what's in progress for Mario, is he's getting lab work monthly. We're monitoring his behavior and appetite daily and his elimination behavior daily, his manure and urine output. An ultrasound and liver biopsy has been recommended by our vet, so I'm investigating cost at those two hospitals and what's involved, because what's involved is trailering him 2 to 4 hours away, depending on where we would take him, which of course is going to up his stress level. And we have to weigh what information we would find from the liver diagnostics. If we find this, how would we treat it? Does knowing what's wrong outweigh what we would do anyway? There are lots of things to consider. If they could come here and do it, we would absolutely have already done it. But there's a lot to consider with transporting him up to a location where we know he's going to be stressed. And then we have to look at the potential outcomes. What we are doing is we're cross fencing a small area for him that's probably 2 acres, and we've put this shed up. When the fencing's done, he will be able to go out in a more pasture-like setting with horses on 3 sides of him. I'm hoping at some point he can go back out with other horses, but his behavior right now is not allowing that. It's too dangerous for him and the other horses. So what are the implications for him? We certainly don't want to end up back in the hospital. And this is a picture of him in the hospital, in the stocks at the hospital, the night we took him in to be admitted. And he was miserable for him. It was miserable for us. We don't want to do that again. So we want to make sure that we're monitoring him for the rest of his life, because we know now this is a possibility that he has a history of this. And we want to avoid repeated illness and treatment. And then we need to keep up on these liver issues, possibly do the diagnostics, and then go from there. I just don't know what to say about that at this point, because we've had him on SMZs, trimethoprim sulfa, which should reduce liver inflammation, but his liver enzymes continue to become elevated every time we do blood work. So that is a concern. Takeaways and lessons learned from all of this for me, and hopefully for you guys too that are listening, are that there is a high prevalence of ulcers in horses, from those that are solely on pasture to those in intense work. Now, those in intense work are going to have a higher incidence of it. So horses that are like endurance horses, racing horses, horses in strong competitive fields are going to have 80 to 98% incidence of gastric ulcers, depending on the study that you look at. Access to 24/7 forage, natural grazing opportunities, clean water, and other horses that they can engage in natural social behaviors with is going to be crucial to preventing ulcer development. And you want to keep them free of other health issues and free of disease, and avoid an empty stomach, avoid forced exercise, avoid transportation, and make sure you're monitoring their herd dynamics, that they're not getting stressed within their herd outside of what's natural, and that you're not making constant changes to their herd dynamics. That is what's stressful for them. The selected references that, if you wanted to do a deeper dive into this, are one that's just a general reference on equine squamous gastric disease, its prevalence, impact, and management. This just goes over, here's the equine stomach, here's their digestive system, here's what ulcers are, here's what they look like, here's how they're diagnosed. And then, of course, the study that I already mentioned by McClure, I went over that. Other really useful resources that I highly recommend is a webinar by My Horse University is who sponsored it, and I have the veterinarian's name in my reference list, but it was about an hour-long webinar on equine gastric ulcer syndrome. It was excellent. I highly recommend it. And then this webpage from redmillshorse.com, they sell supplements and nutrition. We don't buy theirs, but they have an excellent page with statistics about equine gastric ulcers and information about prevention and treatment. And it's all science-based, because you can take that page and you can find the information they have on that page in peer-reviewed resources. So I recommend that page. Is just like kind of a go-to quick summary of it. Well, I want to thank you all for learning with me today, and I'm happy to answer any questions. If you need to contact me, I'm at spiritkeeperanimalsanctuary.org or at spiritkeeperequinesanctuary@gmail.com or through Unity Environmental University. These are additional resources that I'm happy to provide. And Pribble, if you look at the second to last resource, This Dr. Pribble is the one that did the excellent webinar on equine gastric ulcer syndrome from My Horse University. So I'm going to stop the share and answer any questions if you're still awake.
I am. Yeah, I thought you'd like that My Horse University lecture.
That
It's a
was
pretty useful
excellent.
lecture to see, Skelly's, put that on, and yeah, it's an interesting talk there. It's a
It
little
opened
bit
my eyes to a lot of things, and it gave me a
yeah, it's a
lot of
little
places to
technical
further
for
my research.
yeah, it's a little technical for like undergraduates or just owners, but if you have, but it does, you can find some general things, but it is, I like it. I thought it was pretty interesting. So, I think you did a really good job. I don't actually have any questions. Well, actually, I lied. I do. Why are you feeding? Can you go back to the everything you're feeding them?
Yeah. Let me go back to the
Mostly, I
show.
want to know why you're feeding alfalfa pellets, soaked alfalfa pellets.
Just so we feed a lot of soaked feed because do you want me to go back to that slide or just answer it?
No, you can just tell me.
So we feed a lot of soaked feed because we have so many seniors here, and also the increased water intake, especially during the winter. Like I will really wet the beet pulp down more in the winter than I do in the summer because I feel like they don't always drink as much as I feel like they should when it's super cold here. And it's something our veterinarian recommends. And it's also an easy way to put the medication and any medication that he's on in his feed is mix it up with the soaked pellets. So like when he was getting all the SMZs, we were mixing it up with his alfalfa pellets.
Mm-hmm.
So it's just an
Okay,
easy
that
way
works.
for us to deliver feed or to deliver medications and supplements in the feed if the feed is a mash and it's soaked. I also know he's
I'm
getting
all for
water.
mashes, but I'm very, you're feeding a lot of things. I'm always very careful with ulcer and colic horses to feed. I mean, the argument of well, we should feed alfalfa is true, but from an ulcer case, pelleted or even mashes, like for coming out of colic, definitely good. Like a senior mash, senior water, an
Right.
introduction to the gut microbe. But once you have the gut microbe established, of course, a lot of people like to feed like alfalfa pellets and time and a place. But there's certain horses, especially older horses, of course.
Right. So I
But
don't
from a
know
gut,
how we would deliver his supplements and his medication if we didn't
yeah,
give him some soaked feed because he's
yeah.
probably not just going to eat it out of a dish, or he
I just
might.
thought you had two different soaked feeds. You had alfalfa pellets, and then I swear you had something else.
In the beginning, no, his old diet, he was getting hay, like dry alfalfa and Timothy hay, and then
Okay.
his herd was getting soaked beet pulp once a day as well.
Okay.
So,
Then I get that. Yeah.
he's
Then you need.
he's not getting any senior feed or anything right now. He was initially prescribed that when he got discharged. She wanted him to have
Yeah.
dry senior. I'm not sure why dry. We picked him up like
That's
at
pretty normal to
midnight.
go from a colic case to go from senior water to senior mash to senior because you've already established that gut microbe through the senior water and the senior mash, and it is a complete feed, so you're getting nutritional. But if
Right.
you switch that, then it risks all those gut microbes. That's why you keep them on senior dry, and then
Okay.
start introducing other things. And
So
so,
yeah, so in the beginning he got the senior dry, but now he's just getting the soaked alfalfa pellets and
okay.
then the hay in the hay bag. He's not
Yeah.
getting any senior dry. I mean, I don't know if that would benefit him or not.
No, I was just curious if it was just from the standpoint of you were adding supplements to that or what, because from a standpoint of uh, gut health, of course you want long stem fibers as much as possible
And
so
he
that
loves
to sit
hay
in their
too.
gut.
That's him
Yeah,
eating that's not a problem, but it is how we're
yeah,
delivering his supplements and his medication.
yep. Okay, then that makes sense. Yeah, I just always am I always try to cut out in this class, especially because people are advanced enough where they're starting to add things, and this is the time that I back people off everything. I'm always like, what can we eliminate? And that makes sense. You can't really eliminate that, but what can we eliminate to, pair a horse back and
Well, and we do that here too, because I don't like to be feeding horses a bunch of stuff. So we have had horses
yeah.
admitted that were on 50 million things, and the
Yeah.
previous owners are like, they need this, and then I'm like, no.
6 supplements and
Yeah,
agreeing,
so
and
we wean
yeah,
them off all of that and then start them sort of at a baseline of let's see how they do on
yep,
hay, and then let's
yep.
add as we need, because some I can't believe some of the stuff, and some of the stuff people send them on isn't even scientifically supported. They're just giving
Hmm.
it for, I don't know why, because somebody told them it would help or it makes them feel.
Yeah, I feed a lot of mid-quality hay. I will say, people also think like, oh, I just need, which sometimes you need alfalfa from a diagnostic standpoint, and it does matter leaf for stem. You have to keep that in mind,
Right.
especially with some of these issues. But you know, fiber's good for gut. So I always feed
I wish
my high
our
level performance
Colorado
horses
pastures
mostly. Yeah.
were better, but they're just weeds and dry prairie grass. So if in order to have it where they could graze on them, we would have to irrigate, we would have to seed
Oh
them.
no, I think
We don't
it's
do that.
fine. Mid quality hay is fine. I very rarely recommend high quality hay. Time and a place. But
Right.
people want to feed their horses the best, so they think, oh, I need to buy and invest the best, and that will keep. And that's how you get fat, unhealthy horses. There's something
Right.
to be said for a little bit of not bad quality hay. That's not they people have been freaking out about that because they're like, well, we've always been told not to feed. I'm saying mid quality hay. It's a little bit of less nutrition, a little bit extra fiber.
Well, it's easy to
Basically
add.
sell.
If you start with
Yeah.
some kind of baseline of minimal, it's easy to add stuff if you need to, but don't add it if you don't need to.
Yep.
I mean, that's
So
how
I
we approach
I
things here.
I feed like almost ad lib access to my horses, but really mid quality hay because my horses
Hmm.
are such easy keepers that they don't need the nutrition. You know what I mean?
Right.
They'll get enough nutrition when they're eating 10 pounds of hay. You know what I mean?
Right. Right.
Because my horses they'll eat way over that no matter
I
what
know.
quality hay so then they'll get fat.
Yeah.
So
We have a
yeah,
few
that's
like that. Usually they're
yep,
the younger ones that are here for some reason other than something wrong nutritionally or age related. Like we have so many elderly horses here, like in their 30s, that just can't, like they have to eat a mash. They
yeah,
have
of
to
course,
because they
yeah,
can't
from a hay
chew.
standpoint from them, yeah, there's not a lot you can do, whatever fiber you can get to them, you can get to them. But yeah, and just keep weight on and try to get them through. But
I'm really
yeah, I
worried
was
about
wondering.
this liver thing. Now I'm thinking, okay, now we've there could literally be something wrong with his liver. We were
It's
thinking
yeah,
he had liver issues just as secondary to the ulcers and the whole, ordeal because he did become icteric. But now I'm wondering, why are these liver enzymes continuing to raise when other things are, I mean, it's been months now. So now I'm concerned that he actually has
you
something wrong.
know, it it's hard, especially with you don't know his history that well. And appendix, thoroughbreds are hot messes, and that's
I
like when you're
know.
talking about like no
I know.
no forced exercise, and I completely see why. But also, sometimes you have to exercise thoroughbred, which he's not thoroughbred, but he is. You know what I mean?
He
Appendixes are pretty
basically
close.
is. He
Yeah.
If I didn't
Um.
know he was an appendix, like if somebody just dumped him off here and said, here's a
Yeah.
horse, I would be telling
Yeah.
everyone it's a thoroughbred.
Yeah. He's a thoroughbred. There's the lines are so close. The problem with it is they also get very anxious. And so,
Yes.
like, if you force them to exercise too much, it from a ulcer standpoint, it's bad. But also, if you don't exercise, especially when they're kept alone and they're kept in a, even though they're turned out somewhat, but like
Right.
they're not having to force to walk all day to really, really graze really far.
Hmm.
You almost do have to exercise them because if not,
Right.
they're anxious
That's
people.
why
They're like they'll burn their calories somehow. So that's the
we're
problem. Is like you don't want
literally
to.
cross fencing an area just for him because I can't,
Yeah,
we got to get him out. We got to get him back out.
yeah, yeah. So that's what you might have to kind of because like you don't want to force him to exercise in theory because it's not good for their gut, but at the same time, he's going to figure out a way to be anxious. Thoroughbreds
Hmm.
do.
He is. He
Arabians and
does.
thoroughbreds are, they're going to like you have to. Sometimes you have to do force exercise and lunging or do something that burns some energy. Either way, he's going to figure out a way to be anxious, and so you
Right.
figure out the lesser of the evils. Doesn't make sense. And
Yeah, it
sometimes
does.
with certain horses, that's the lesser of it. Lesser of
Right.
the evil. which way do I keep him from being the most anxious? And so that's what I was going to say, how liver enzymes,
Uh-huh.
that could even relate to some of the liver, like basically is that the colic, I'm going to go ahead and say he had ulcers before in his previous life, considering his back, you know what I mean?
I think he
And then,
probably did because there's a bigger
yeah,
history that I didn't have time to go over. Like he came here in 2014 with this big history. And then after he became a resident here, all of those issues went away, or did they? Like maybe
yeah,
I'm thinking he had ulcers for sure back then, and they mostly went away, but now something's just caused them to resurface.
it could have been the colic and, medicines that and then now it's kind of, and that's where I was like, well, you might have to force him to exercise, especially since he's not out with a herd,
Right.
because he might be a little bit too anxious. And it's just, yeah, like, it could have been the colic, it could have been lack of water or something like that, and he colicked.
Right.
And then now it's all kind of, he
Well,
already
it's just
had
so
ulcers and
strange.
already had
We have so many
liver
horses
issues, and
here,
then it's
and
been like building then.
usually you take one away for something and they come back and their herd's like, oh, we missed you. And it's just like, we're so happy to see you. And we've taken in horses that used to live together and haven't seen each other for years. And they see them here at our sanctuary and they're like, oh, I remember you. I love you. We brought Mario back from the hospital and it was like his herd attacked him. They ran him through a fence. Um, I'm like, I've never actually seen that happen before with a
You
horse that
might
was
hear,
part of a
so
herd that
yeah.
you bring back. Like we've been doing this a long time and I've never had that happen.
So what
And
I
he
would
is
suggest is
acting weird. His
try
behavior is
to,
different than it was before this all happened,
yeah,
even with us. Like his behavior
yeah.
is off.
Yeah. Well, that's, horses in pain and horses, they do, and that's what I was going to say is you might go the force. I mean, talk about it, but like you might go the lightly force exercise, not like run him into the ground, and
Right.
then take another horse out of that herd that you think kind of middle of the pack, not too low in the totem pole, maybe mid to low, but not too low. But also don't
Right.
take the dominant horse in the field. And basically, you want like a middle horse that he can
Right.
basically pair up with. But what I suggest is like exercise them both first and then pair
Right.
them in a paddock together so that
Well, his
then
herd is
reintroduce.
out on that 15-acre pasture I mentioned. It's our
Yeah.
biggest one, and that's where his herd is. It's just they're just
What do
out
you have
there.
in the 5 acre right now? Do you
We
have a
have
little herd
two
out there?
older mares, two
Oh,
Arabian
okay.
cross
Because I was going
mares
to
that are
say,
like 28
basically,
years old.
if you take him, size him, so because part of it is also his cognitive. I mean, part of it might be in pain, but part of it also is his anxious energy. Just like
Mm-hmm.
dogs, horses don't like that anxious energy, and they're going to, they don't. He's a risk mentally for them too, because
Right.
he's kind of just an anxious ball of disaster, and
But
who can blame him?
it's so strange he wasn't. Like once he settled in here in 2014, he's been quiet, he's been mellow, he's been happy out with that herd, just living life. This is a really big change for all of us to have him going
Well,
through
yeah, but if you're in chronic pain, that does
right.
change your anxiousness, and
Absolutely.
especially not just that. Oh, my toddler doesn't want me to talk through
That's
his show.
okay.
Um, but not just pain, but also because he was away, and because he was in a big pasture before being exercised with his herd.
Hmm.
He now just like I get that way when I'm inside, right? I get kind of anxious, like if I'm
I do.
inside too much.
Yeah.
I just like I'm being outside. I'm used to working. And at first it's like, whoa, it's such a relaxing and like I'm just gonna lay in bed all day and it's gonna be nice. But then after like day 3, I'm like, okay, this is not fun. I don't like this.
Right.
So then I get anxious. And both of those combinations of anxious and pain probably translate to the herd of, this horse is a disaster. So
Right.
what I suggest when that happens, when a horse is kind of rejected from the herd, is like I said, exercise them both so they
Hmm.
don't kill each other, but also exercise him, not hard, but like enough that he's not such an anxious hot mess. You know what I mean?
Right. Right.
And basically put two horses together, like I said, you don't want too low, because if you go too low, like yes, help to buddy up with them, but then when you reintroduce them, they're both going to get beat up. Doesn't
Correct.
And then I like to introduce like one at a time, and then and 3 total, so him and 2
Hmm.
other horses, and then I introduce that back into the field if a horse is getting really really beat up, because then they have 2 other horses that they have
Right.
now formed like like the group is a new group. So like it's two groups rather than
Right.
one horse reintroduction. But a lot that I will say that is it helps a lot. So in this case, it's hard because you don't want to exercise them too much, but exercise helps an anxious minded horse. And he is just, I mean, I don't know him, but I'm assuming from a thoroughbred standpoint, he's an anxious minded horse, you know?
Yes,
So
he is.
that's the problem, you know, from a herd standpoint. So that's what I talk about with the lesser of the evils with the forced exercise,
Right.
because like, would he be happier if you can get him back in the herd? Yes, he would. You know what I mean? He
I
would be
think
a
so.
much more, he'd be much more, any horse would be a
Well,
much
and
more stable horse when
so
they're back in
the
the herd.
area we sectioned off is part of his old pasture. So we have just cross-fenced part of his old pasture, put a loping shed there. So he is going to be in part of his old pasture adjacent to his old herd. And I am hoping, that was my plan, was I wonder if we can put one horse in the sectioned off area with them. And then over time, because they're going to be adjacent right over the fence, he can
Mhm.
just reintegrate into that herd.
I hope. Try to, like, if you go to that, try to, like, if you can fit, try pairing
Yeah.
him up with two horses and not just one. Because, like I
Okay.
said, I've just seen it be more successful because it like dilutes when you
Right.
reintroduce them, it dilutes the energy. It gives it's more spread out, and then it's
And
two
what
herds
is
going together
so
rather than
interesting is he was sort of in charge of that herd too. Like he was the one, it's 9 horses, so 8 now
yeah,
without him. But he was the one that would rule the roost. He was the one that would
yeah.
push everyone else off the food, and like he'd go to all the hay piles, and then finally everyone would settle. I was shocked when
Yeah.
he got home and they were just like, we want nothing to do with you anymore. Like
Yeah,
we
there's a lot to like I
leader
said,
now.
thoroughbreds we see it a lot, even if they're not number one. Pain does substantially affect that, but thoroughbreds and Arabians have a really hard time sometimes with that because they are such anxious horses that when you reintroduce them, it doesn't always encourage a stable environment. And then the horse herd that is stable doesn't want anything to do with a non-stable, you know,
Right.
horse. Like, you know, it's such a in their minds, naturally, it's such a danger to them to have this horse that's
Right.
such a, you know, train wreck. Not from a physical standpoint. I mean, his might be from a physical standpoint, but
Right.
from theirs, he's anxious and pacing and all over the place, and he's, you know, like, and they can feel that, and they don't like that. And so that's where the forced exercise. I unfortunately had to do some of that because I would rather them be part of the herd, you know, than
Right.
not, because that's healthier for them too. But sometimes I get those thoroughbreds that we, you know, just from universities, we get a lot that like are such disasters that's why they were sent to, you know, they were donated because they're, you
Right.
know, kind of
Of
a mess.
course. Of
But
course.
they are hot, you know, they're hot minded, and so I have to be like, okay, well, you need to calm down before. I want you to be part of the herd, but you can't go in with this. I mean, no,
Right.
you know, people are like that too.
We
Nobody wants to go in and have someone that's like,
I know. We don't
ah,
take
you
in a
know,
lot of
like that's not
thoroughbreds
fun.
here. Like I try to say, like, route them to a thoroughbred rescue because they deal with them all the time. We have a couple
Yep,
here, but we actually
yep.
do have a lot of Arabians here. And I never have any issues with the Arabians, the quarter horses. It's some of like the Andalusians, the thoroughbreds, some of these other breeds, saddlebreds, to me are more high strung. The Arabians and quarter horses we have here are really, honestly, those aren't the ones I can think of ever having issues with.
Arabians can be okay because they can turn their hot energy into other forms of energy. Thoroughbreds normally don't. Like, they want
Right.
you to turn it into energy themselves. Does that make sense? Like, Arabians, when they get hyper, they will find an energy source. Now, I will say sometimes that turns into aggression. You know,
Yeah,
sometimes they
we
get
haven't
so
seen
anxious
that
that
here, but also ours are
it
out on
happens
pasture.
sometimes.
I mean,
Yeah,
ours are
sometimes it
out.
just,
We're not trying to keep one in a stall and like
yeah,
make it eat twice a day either. Our
yeah,
Arabs are out in a big herd on pasture and they're as happy,
yeah,
they're just like, we're cool.
yeah.
We're good.
But, well, especially older ones too, you know, they can figure out their own workload. But thoroughbreds don't tend to do that, and that's why you notice that much is
Okay.
thoroughbreds tend to not like want to be worked, but they just get inside their own head. They're like, oh my gosh, oh hi buddy, oh my gosh, 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 oh my gosh.
What I
And
have
you know, like some
noticed,
people, like I'm,
he gets hyped up and it takes forever to
yep,
bring him down. forever.
Yeah. Like, so like, I'm like that. I'm more like Arabian. Like I get hyper and I'm like, I need something to do. I'm going to go clean. I'm going to use this energy, right? I got to cut the grass anyways. Let's do it. Like I'm ADD. Thoroughbreds are not that way. They're that kid that like gets really anxious for test and just cries and melts down. They're like, and you're like, yeah, but you need to use this. Like you need to channel this energy to
They
do
need help
something.
directing that
That's how
energy
Arabians
somewhere
are.
productive.
Yeah, yeah.
Yeah.
Thoroughbreds tend to be like this, the kid that's like gonna melt down. You're like, and then just like basically fail out of school because they're like so melting down, they like can't handle it.
It makes sense
Like,
to me
oh my
because I
gosh,
see
like
that.
the
Yeah.
world is ending, and you're like, okay, come and yeah, yeah. Like focus your energy into something.
I
Thoroughbreds
feel
are
like
really bad about.
we have
Sometimes Arabians
selectively
are, but sometimes they will focus into like,
I feel like we have selective, like we are at fault for that with thoroughbreds through selective breeding up for one thing and one thing only. Like I feel like we've made them a nervous wreck by just breeding them to race. But maybe I'm
yeah.
wrong.
They also part of it's training, and no, it's kind of a combination. Thoroughbreds, it's hard to tell because thoroughbreds are such an old breed, and they've always like they've always are not, because like you did select them, but it's not just racing, it's also jumping and yeah.
Right.
um so that's kind of where it kind of comes. It's a hard one. That's a hard one. um you also see a lot of people own thoroughbreds that probably shouldn't. Like, here's the thing about Arabians, they're so well known to be like, oh, quote unquote, like nutsos. Like, and we've all seen crazy Arabians. I've also used Arabians in therapeutic riding programs. So like
I
I've
mean,
had,
yeah,
a
I mean, I
variety.
don't see it, but I work with them
But
all the time and I probably give them proper outlets for any
yeah,
energy they have.
yeah. But so many people like don't get Arabians because of that. And there are so many people that rescue thoroughbreds. That's also a problem. It's like they don't know how to effectively manage their, like, every breed has their problems. Just like dogs. Like,
Right.
people don't think of horses as not like dogs. Like, you pick the breed that's right for you. Like
Exactly.
like like you should probably, if you live in an apartment and are low energy, you should probably not get a border collie. You know what I
Right.
mean? Like, you should get the animal that's the right one for you, rather
I
than
tell
like
people this
like
all the time.
people give, yeah,
If they get in front of me
dogs,
for a
breeds
behavior
including
consult
bullies, like, or like pit bulls.
for picking out a new animal, whatever species it is, I help people choose animals that are right for their living situation and their circumstances. We go over this to exhaustion because people want to pick out
Yep,
animals on how they look, or their friend has this one. And it's like,
yep,
no,
yep,
that is
yep,
not going to fit your lifestyle. That's not the
yep.
right species or
And
right
that's the
breed for
problem
your
with like
lifestyle.
the pit bulls, is it's not pit bulls or are like, oh well, it's just a terrible breed. It's that a lot of people that pick up pit bulls or rescue pit bulls, like, they're known to, and not just pit bull, bullies. But any kind of bully breed is known to be hard headed. Now, they are loyal and they are very good at a lot of things, but they can be a little hard headed. So if this is your first dog to train, you probably shouldn't pick the hard headed breed. You should go pick some like willing Labrador gold, like that.
Right.
Sure, you should also probably not pick the smartest dog in the bunch. Like, if
Correct.
this is your first dog, a border collie is going to be rough for you because they're going to outthink you. You know what I mean?
Yes,
So
I
same thing,
do.
yeah.
It
So a
is the
lot of
same
people
thing.
don't do that with horses, and they get like given thoroughbreds, and so that's why thoroughbreds are one of the harder breeds, because between like their industry is the race industry, so that produces a lot of
Right.
challenges, and then the people that rescue them tend to be the ones that are just like, well, I want this cheap horse
Right.
person here's given to me, and I kind of write English. And there are some people that focus them and do things with them, but a lot of them don't, and they just, they either like sit them out in the field and kind of ride them, which is not good, or it's not the way they train them, is not the correct way. There's a way to train and ride
Yes.
horses that is not as forced and given choices, and teaches horses, like what we're talking about, like
Yeah.
teaches horses to like accept things like trailering and things like that. It's never good, but you can learn to become accustomed to
Right.
it, but in your own way. Doesn't make sense. Like, you don't get forced to do it, and thoroughbreds get forced to do things a lot. You know what I mean?
Right.
Like, which we call like normally flooding. That's a flooding technique.
Correct.
A lot of times, well, there's other techniques like basically like, well, you're doing it, so we're gonna
Right.
twitch you and force you in here.
Correct.
Like where
So
there's
we do
other ways that horses get
cooperative
choices.
care here with our
Yeah.
horses, but also now I'm doing
Yep.
cooperative riding. Like I'm approaching training so much different now, where the horses are like they approach me, they allow me to groom them without being restrained and be saddled, and we do all of that sort of opposite of traditional, because if you're not leaving, like if I'm grooming you and saddling you and mount and getting on you and you're not leaving when you can, then I'm assuming you're okay with this.
Yeah. Yeah.
If I'm doing
There's
all
a
that
lot
and
of
you're
that.
restrained, then I don't
Yeah.
know if you're just tolerating it because we're restraining you, or if you're
Yeah.
okay with it.
Yeah, and that's the problem with thoroughbreds. You're just going to go ahead and assume that some of it was forced, which probably produced a lot of those initial ulcers. You know what I mean? And
Right.
so that's where that's where you see a lot of thoroughbred disasters. Is
Well,
the
and
combination of it's not just the industry, it's just the combination of a lot of building factors with
I do.
thoroughbreds that we don't always see with the other hot breeds, because people tend to stay away from it. Like unless you either like are on the Arabians and you know how to handle it, you're going to do it, or you're like, oh, they're crazy, so I'm just going to get whatever podunk horse, and then they adopt a horse that's kind of more cool blooded. Whereas thoroughbreds are not the way. Like they're hot blooded animals, and they get adopted by people. They were forced to train in a hard way, and then they get adopted by people that are normally always not knowledgeable, and so like it's a combination of a
Yeah.
triple whammy for
I mean, Mario
thoroughbreds.
had
So
that
yeah.
history,
So all
which is
right. Well,
why he
yep,
probably did have ulcers. But
yep,
thank you.
yep.
Thank you for your time. I know this was long, but I was really approaching it from the mindset as I'm going to present this like at a thing. So I
Yep.
wasn't prepared for 10 minutes.
Yep.
I was
You
more
did a really good
prepared for
job. I think you
how it
learned a
went.
lot in this class.
I did because
Yeah.
nutrition is generally not my
I think
thing,
you did
like
a really
not
nice job. I
deep
think you
dives,
learned.
but I'm thankful for it. It made me do some deep
Yeah,
dives into
nutrition. That's why
nutrition.
somebody's like, I don't want to do nutrition. I totally get it. Nutrition is, yeah, it's brutal, but like understanding it is very helpful from a rescue standpoint.
It
It
is. It
is
is.
boring. Like I mean, I love nutrition, but it is boring, and it is rough. But it definitely is a standpoint of like, it's not actually, when you see it this way. I mean, ulcers are hard, but like basic horse nutrition, like it's not actually that complicated. It can be once you get advanced. So like basically feed horses fiber. Like
Correct.
only add if you need to. Like
Right.
add is what I want you guys to walk out there understanding, and that's not that hard to understand.
No,
Feed
that's perfect.
hay and grass. If you need to add. But like if you can get away with it, don't add. And that's all I want.
Yes.
All
No,
right, I think you
I
did a good job.
agree.
Hey, yep.
All right.
Did you post your other discussion this week?
Um,
Your
okay.
reflective? I can't
So
remember. Did
I
you do your
posted my
reflective?
reflexive and I think I responded to one person. So I need to go back and respond to somebody else's. And then
Yeah,
I
why
need
don't
to
you
post
upload
up
this?
this recording up
Yeah.
to the gallery.
Yeah, go ahead and post this, and if you can, just quickly do another reflection, and then I'll
Okay.
go ahead and I probably want to know, because it depends. My kids are all over and timing of going to bed, since we like changed time zones, and then we got back to 3. So we'll see what time they go to bed. But
Okay.
I need to do David's too. But then I can grade it and be done. Like then you're done officially. You can see your grade. I can't submit the grades until everyone's done.
Right.
But then, what I like this class at the very end, when you have to present, you present live. But then, like, go ahead and you get it done, and then you're completely done with this class.
That's good because I'm enrolled in 2 classes and
Because
I
it's a
still have
tough
to do
class. So
my presentation for the other class. So that'll be good. And you've been so
you're
super prompt
just,
with grading. I've been very impressed. I'm like, wow,
oh,
she is
thank you. That's why I was
grading.
like, just go and do you already know your grade. Just do a quick response. Like, you don't have to do another response that's like, like, oh my gosh, a longer. Just like kind of do one that's kind of medium and call it good, because you already
Okay.
have the grade.
All right.
Then you're
That sounds
check done.
good.
You're not gonna like lose a bunch of points for that.
All
So
right.
okay, and
That
then it's
sounds
done.
good. Thank you
All
so
right.
much for all your help. It's been great.
All right.
Thank you.
Thank you. Bye.
Bye.